Well, hello, beautiful people, and welcome to M4L Academy's Rhetoric for the Republic. I'm Missy Karwowski, director of M4LA, and I am so excited for today's conversation. This debate-inspired conversation is going to be on whether or not we should restrict social media for minors. Social media has, without question, been causing extreme harms. We've seen this for years, frankly, and just if for no other reason, let's see, the most common one we hear now, I think, is brain rot. But we know of all of the other harms that are out there for our youth and teens, the self-harm, the addictiveness of the platforms to children. There's so much that goes into this. And last week we unpacked with Wired Human how manipulative these platforms are as they're intentionally trying to get your attention. And really, they're selling your data. You are the product. So today we're going to have some incredible speakers on. We have Laura Derrendinger. Oh my gosh, Laura Derrendinger, who is a public health nurse. She is going to be speaking for the restriction of social media for minors. And then we have Julie Smith, a professor at Webster University, who is speaking against the restrictions of social media for minors. So without further ado, we're going to start it off with opening statements from each of you. And so let's see. Julie, let's start off with your opening statement on why we should restrict social media for minors.
Why we shouldn't is mine.
Sorry, why we shouldn't. Yeah. Yes.
Although actually, I wish we could.
I think that's why I said it, because it was a Freudian slip there.
Yeah. So I've taught at Webster University in St. Louis for about 24 years. I wrote a book called Master the Media, How Teaching Media Literacy Can Save Our Plugged-In World. And I've spent the last 10 or 15 years traveling around doing workshops and conferences for students, K-12 teachers, and parent groups, and basically anyone who will listen to me talk about media and digital literacy. So I'm so grateful that you asked me to come. Thank you. And it's interesting because I think that I was asked to come thinking that I was very pro-social media, and I hate it. It's awful. But I have a realistic view of it that much like winter, we don't like it, but we can't do anything about it. I feel like the platforms are here to stay. Sadly, we can't put the toothpaste back in the tube. So what I like to do is suggest that we educate the students and the citizenry about these platforms and how they operate, why they operate the way they do, and how restrictions, even I wish that they could work, how students and kids have so many workarounds, any restriction that we could possibly work up. So I'm actually on Laura's side. I just come at it from a different angle.
All right. So that's where this was an interesting or is going to be a particularly interesting conversation, I think, is because we actually have two folks that are both against social media, but you are more for the perspective of not banning it outright, not fully restricting it, but instead educating.
Yeah. And maybe, am I just like playing possum, like just saying, well, there's nothing we can do about it, so maybe we should just teach about it. And I hate how that sounds kind of defeatist. But I know that there's a hunger out there for information about these platforms and how they operate. And so I'm happy to provide that.
All right. Fantastic. Laura, let's pass it over to you.
Thank you. And thank you so much for having me. I enjoy any opportunity that I can talk about this and share my perspective. So I am a public health nurse by background, and I have 4 children, so I'm in the midst of it, 16, 14, 12, and 10. I always have to count in twos. And 3 boys, 1 daughter. And so a lot of times I get asked, why am I doing this, and how did I come to this? So before I was a mother, I worked overseas in conflict zones with Doctors Without Borders and with the International Rescue Committee as a nurse in war zones. And my job was not just patient care, but it was also to assess and understand what do we need to treat. When you go into a lot of these refugee camps, there's so many dynamic variables that happen. There might be 20,000 people in the camp when you arrive, and then in 6 months' time, 100,000 people. So the needs change. And what our job is as healthcare providers is to see what are the leading causes of excess illness and death in our population. So we look at that. We sort of doing a scan or assessment of the community to look at why our children, we prioritize children getting sick and dying, and then we tailor our intervention that way. So for me now, coming into this setting here in the US, I am asking that same question. What are the top reasons in our country for why children are getting sick and why, very tragically, they are not reaching their 18th birthday? Oh. And that is so hard to say, but we have to know what the data is. So in the US, and I have a graph that will be projected here, but basically when we look at the data on youth mental health trends, and not self-reported data of children saying they are depressed, but actual visits to emergency rooms, children go into emergency rooms for suicide-related emergency room visits, for intentional self-harm, for self-poisonings, and for suicides. When we look at that data, up until 2012, these numbers were stable. In 2012, which is the data point of exactly when most children in our US population were both using smartphones and social media, we see a very steep increase, absolutely, in all of those rates that we had never seen before. So the other data point, and again, I have a chart here that we can project later and show, is that when we today look at, if we're going to list what are numbers 1 through 5 of what are the leading causes of death for why children don't reach their 18th birthday, the second leading cause of death for children over the age of 10 is suicide.
Goodness.
So from that information, that's as if I'm just somewhere doing my scan of what are our priority interventions. What we can then do is look at what are the contributing factors. So when I was in refugee camps with Doctors Without Borders, say we discovered that children were getting sick and dying from malaria, what do? We have to look at the disease and understand how do we control the vector and what are we gonna do to manage this. Obviously, we need to have the medications on hand to treat malaria. Of course, we need to be able to treat the disease, but it's going to be much more efficient and urgent if we prevent the disease from happening in the first place. And as a public health nurse, that's where my bias is. I want to prevent children from getting sick. And that is why this is an emergency for me. It's even though I worked in emergency conflict zones here in the States, when I hear that suicide is the second reason children do not reach their 18th birthday, that is an emergency. And that is something that we can do something about. So in our diseases with malaria, we didn't do just one thing. We have in a public health framework, when we do population and disease management, we have many tools. And the key thing is no one lever or no one tool by itself will ever be sufficient when we're controlling and managing to address disease outbreaks. So in malaria, it's environmental interventions of making sure there's not stagnant water where the mosquitoes can breed. We're distributing mosquito nets. We're treating the mosquito nets. We have prophylaxis medicine. We're doing everything what we call upstream to do the prevention. So then I bring that analogy just back to what we're dealing with here. We have plenty, mountains and mountains of literature which show a very strong relationship. And we can say now that social media and smartphones are a contributing factor. They are not the only ones, and we'll never say it's the only one, but it is a significant, when we isolate for other variables, it's a significant standalone contributing factor. So with that, we can say, well, what do we need to do in the environment? What tools in our toolbox do we have to address that? So absolutely, we want all the education possible. And I want Julie to come to all schools and train people on her curriculum because absolutely we need people to be aware of what's causing kids to get sick and what is this and what is this vector of disease, which in this case, the vector of disease is the phone. And then social media is our disease pathogen, which is creating illness in our children. So 100% we need that. But then we also have the entire toolbox of everything else environmentally that we need to do. So environmentally, we talk about how to decrease exposure to the health harming product. So one way is that we put in place phone-free schools. social media free schools. So we carve out a place. One thing is going to be an age minimum, which I'm saying should at least be age 18 to access social media products. Others will be warning labels. I absolutely want warning labels because that's one way to get information out to everybody. We need better design features the same way we need safer cars. We need phones and any of these online products to be designed in a safer way. And we just overall definitely need to carve out spaces like we carved out for smoking, places that we just all agree that we're not going to smoke. So for me, again, going back to one thing in isolation isn't going to work. We absolutely need all of them. And I'll close just with one really profound statement because this came from the Journal of the American Medical Association. So these were population researchers. Dr. Stephen Wolfe is a lead author. He wrote this with Dr. Frederick Rivera and Dr. Elizabeth Wolfe 3 years ago, and they described this same trend. So we have lots of people talking about this trend, about what is happening to our children in terms of why are so many children having so many visits to the emergency room for suicidality. What is happening? And so this physician independently saw the same data. He hadn't read Jonathan Haidt. He hadn't read Dr. Jean Twenge's research. This was somebody else. And that's what's amazing is that many different data sets are telling us the same story of what's been happening. But the language in this article, which I was saying from 2023, I carry around, is that he said, all of the gains that we have made in the past 100 years in medicine to keep kids healthy and to save lives in the past 20 years are now being undone by man-made pathogens.
Wow.
That's what motivates me to share that information and provide that framework.
Wow. Well, that is very powerful information. That is insane to think of such steps back or being undone, as you said. So I don't want to take up too much time. So now it is your turn. Back to you for a rebuttal.
And I'm really happy to be a tool in your toolbox, for sure. I was thinking that maybe I could be like some sort of immunization, right? Or mosquito netting in this issue. The only thing that I don't trust the platforms to come up with a reliable age verification tool. It's not in their best interest, and I don't ever expect them to do anything that's not in their best interest. I know I sound so cynical here. Kids lie about their age like crazy. And this is just what kids tell me when I am in K-12 schools and in my own university classroom. They can easily use VPNs, like the kids in Australia can use a VPN to pretend they're in a different country. A lot of the parents are online more than the kids. And even if I worry that if social media platforms get banned, how are we defining social media? Because I learned how to change a tire watching YouTube, but YouTube is actually considered a social media platform because we share things on there and like and comment. So by definition, that's also a social media platform. So even though, I mean, it's a digital hellscape on YouTube sometimes, but there's also accessible and interesting stuff that you can learn on there. I feel like I worry that the kids are more tech savvy than the lawmakers are. And it can't be retroactive. Like how would we handle the platforms that are already on the kids' devices? I love how the Surgeon General last year came out and said there should be warning labels on social media platforms, but I'm not sure that I feel like that might be catnip for some of the teenagers in specifically. My attitude is that we can't outrun this, we can't outlaw it, but we can outsmart it. And so that's what I try to do when I talk to students and parents and teachers, is try to help them kind of see behind the curtain of how all of this works so that they're more in control of this. And I hate that word empowering. I think it's so cliche, but I want them to have more control over their digital life than being the victim of it, if that makes sense. Because clearly everything that Laura says is absolutely true. In fact, when I go into a school that's phone free, I know the minute I walk in, because the kids are talking to each other. they're having fun. They're playing around. They're goofing off. Whereas when I walk into my classroom at the university, it's completely silent because they're all sitting there on their phones before class starts. So you're absolutely right. I just wish there was an easier way and a really effective way to do what we'd like to do.
Very good points made. So, all right, back to you. So do you think there's I guess that's my question right away, is there an easier or more effective way? And what are your thoughts?
Well, first, I would like to take universities like where you're working and you're a champion there and say, hey, we've done phone-free schools K through 12. How about helping some universities put phone-free policies in place? So what is social media? I think looking at what Australia is defining as social media is going to be fair for the...
So how are they defining it? I'm not familiar.
They have listed certain brands.
Just list the platforms.
Right. So I believe it's the usual...
Yeah, the usual culprits.
The usual category of health harming products. That's why I always like to frame it that way. So it includes YouTube and Meta and Instagram and Snapchat and
TikTok.
Yeah, so there's a list. That law goes into effect on Wednesday.
Wow.
So this is so timely that we are talking about this right now. So it is defined, and I don't know the full details of what Australia is doing, but whenever people bring up the topic of we are going to have a hard time enforcing it, or it's going to be an invasion of privacy, those sorts of reasons. So what I've understood, thankfully, I've been part of a large coalition, our Screen Time Action Network coalition, since 2018. So it's a multidisciplinary group. We have nurses, healthcare providers, attorneys, academics, teachers. What I've learned from the attorneys in our group and the people who have expertise in the online product industry, they know all the information already now. They have all that information. So it doesn't matter what a child says their age is. The company is able to decide that. And there was discern that. They are able to reasonably know exactly how old a user is, because they have so many data points. And that is
terrifying.
A research paper out of UC Davis, I can send you the link, just tested this and was able to reestablish that. And that was just published about 2 weeks ago. So that argument is just, I know industry wants to use that argument to their advantage, but if we're on any of these products, that's the business model, is for them to know that level of information. And the other parts about enforcement and kids getting workarounds, well, yes, and we have a age minimum on cigarettes and alcohol, and sometimes kids still get a workaround on that as well. I think the point is, when we go back to the multi-tool framework of why we're doing many things in the toolbox, and this is just the classically how we address many things, is that absolutely no one tool will work 100%, but we need all of them together in order to have a meaningful impact to prevent excess disease and death in our children. And we have to keep talking in those terms, because we are at a point where children are dying because of these products. So we can do everything, and no one tool will be perfect. But if that age 18 law, if we could get it in place, that will protect some kids. That will help some parents. For some parents who might need that extra support, they can just say, hey, well, it's illegal now, so I can't do it. So it gives parents a level of backing. Warning labels alone won't help. But for people who do come across them, it can help them. And there is research supporting warning labels. There's a ton of research behind tobacco warning labels. So they are effective, not 100%. Clearly, some people still smoke, but it did make an impact on some people. So for education as well. Some parents, you might talk to 30 parents or 30 students, maybe 15 of them will fully internalize your message and go home and say, I'm going to change now, and I'm going to make a decision to do something different. But there'll be another cohort that they'll need to hear it 5 times or 11 more times. And
then they're the parents who don't even show up.
Yeah. So it's just, it's like a net. It's just layers and layers and layers that we have to have in place. And so, yes, nobody's claiming that it's gonna work 100%, but it'll work for enough people that it's worth to give it a try. And that's why I'm optimistic now, because I've been doing this advocacy since 2018. Remember, these rates of mental health problems in youth, and it did not start after COVID. A lot of people say COVID caused the mental health crisis. It did not. It well predates the COVID pandemic. So I've been working on this since about 2018, actively, sort of full-time doing this. I call it independent research-informed advocacy. And I'm so hopeful now that there are these conversations and there is so much momentum. And so now is the time to lay on as many protections as we can while we have this window, while people are listening, and people are listening. So I'm very happy that we have an opportunity to do this.
I do feel like the pendulum is switching. I really do. And it makes me super happy because I think that everything that Laura's saying is absolutely correct. What worries me the most is that I'm not sure enough people care.
Ooh.
When I talk about digital literacy and media literacy, I think people are very comfortable in their zombie state. And how do we help them see beyond that? I think that's a big challenge for those of us in this space.
You used exactly the language my 14-year-old daughter uses to describe her peers.
Wow.
So my children do not use any of these products because I'm their mother. And we went through a little bit of a phase with my oldest two, who are 14 and 16. But it was just, that's kids' job, is to test and push boundaries and ask. And it's my job to say, I love you and no. Mm-hmm. and now that they're through that middle school period, especially, it's really not an issue, and they are becoming advocates themselves. Yes, how do we break people out of that zombie? So again, we have research, and that's just in part where warning labels and even the messaging of an age 18 minimum law, it wouldn't just be the law of itself, it's the messaging that comes with it. The same way in Vermont, when we just passed this phone and social media free school bill. So now in Vermont, it's illegal for schools to use social media to communicate with students. It's not just functionally that's great. Now we have done a little more to protect those students. Now the football coach or the basketball coach cannot make a team Instagram account and basically put kids on Instagram, because that's one of the big challenges for parents, is they might have wanted to not give social media or allow social media product access, but the school was essentially endorsing a very dangerous health harming product. So that's now illegal.
GroupMe was a big one for teams. Yeah.
So, but that law has sort of a 2-for-1. It helps protect the kids, but also it now sends a message. The school, which is a beacon of the community, we have the corner store and the church and the school and our different institutions in the community, which are trusted messengers. We now have the school, which is a trusted messenger, who is going to say, we're not endorsing these health harming products anymore. So that sends a message to the community. But I'll say another way to kind of get people out of it, there are amazing documentaries out there that are available. So Can't Look Away, The Case Against Social Media, is a documentary that was produced by Bloomberg back in April. Myself and our parent membership have been doing a lot to show that film, because that film functions as a warning label that we really don't have yet. It explains the tragic stories of what has happened to these children. And up in Vermont, somebody just showed that last night.
Oh,
and so it's free for anybody to screen. And I got feedback that somebody said, oh, I need to take this and now show it somewhere else, to just wake people up.
So real quick, I want to jump in and say, if anyone from the audience has a question, please just stand up and our producer will direct you to the mic so that we can get that asked to our amazing speakers. I do want to ask, so I'm going to start some of the questions with, I think that clearly we have some agreement that there are dangers here. However, when I hear warning label, and I'm not saying that this is necessarily the view of Moms for Liberty or even necessarily of myself, but I'm going to play devil's advocate and ask some questions, because I think one of the things that we need to do, like I said, is encourage conversation. And we like to educate our members on how to respond. How can you respond when you're out having a conversation with someone? So to me, while I understand that there's the dangers of, social media to the point of putting a warning label on it, et cetera, how do we expect that it's not going to result in kids kind of going crazy? Because how were you saying it?
Forbidden fruit?
Yes. Yeah. Because since they're not allowed to be on it, that makes it's like drinking underage, right? That we see a result where kids are binge drinking as opposed to drinking responsibly. So how would you respond to that concern?
So, I would say that it starts with our role as parents and parental attachment. And we don't have evidence that because alcohol is illegal and not allowed for minors, that the kids who are restricted, then all of them binge when they get to college. That is not the case. And what I found is that through healthy attachment with our families and being grounded in what we call the vertical hierarchy of our culture, as opposed to peer orientation, that is how we're going to really address that. We want our children coming to us as the trusted adults and other trusted adults in their lives. We do not want them going to their peers for advice. Dr. Gabor Mate and Gordon Neufeld wrote a fantastic book originally in 2005, and it's been updated again. It's called Hold On to Your Kids, Why Parents Need to Matter More Than Peers.
Oh, wow.
So that's a family physician and a psychologist who co-wrote that. And it is a beautiful book because they speak clearly about how one of our problems is that we have become a very peer-oriented culture. And they say that is very unhealthy for our kids. Everything as parents is against us in that fight.
Mm-hmm.
Even to the point where the commercial industry has called us parents. They refer to us as purchasing friction.
Oh.
They say that they need to remove purchasing friction.
Oh, my goodness.
So the more they can push any narrative that this is here to stay, the kids are going to be on the devices, let them use it. They want to remove parents from choices that kids make. So that's a commercial industry strategy. Mm-hmm. So one way to fight back against that is to, through our dialogues, debunking. A lot of people always told me as a mother, your children need their friends, they need their peers, they need to have lots of friends. Well, no. First, they need the adults in their life. So that can be parents and teachers and faith leaders and our pediatricians and adults in the community we talk about the vertical hierarchy, to really mentor them and teach them. So personally, my son, when he was 14, because in Vermont, we need firefighters. When you're 14, you can join the Vermont Firefighter Academy.
Wow.
And
20 seconds.
I enrolled him, and he's gone to Fire Academy training. And every Tuesday they meet and do their training together, and he gets to respond to fire calls. So he has amazing mentors in his life because he has those abilities. He's now 16, and he's very proud that he is a junior firefighter.
Needs that kind of relationship. So let me put it over to you. So I heard some scribbling, so I think you
Right. Because when you were talking about parents being purchasing friction, from my media studies background, I'm thinking about every sitcom that's been produced in the last 30 years. Not one of them has a parent that's not an idiot. Mm-hmm. And I think that a lot can be gleaned from that. And
it's a very good point.
The best advice I got when I was pregnant was, if they're never mad at you, you're doing it wrong. And I can tell you as an instructor, like the freshmen that we're dealing with now at the university have never been mad at their parents. It's very, very obvious.
Well, maybe the parents should ban social media to make them mad.
Well, but I think that so that brings me to another story. I was speaking at a girls' high school in St. Louis, and a group of the girls came up to me afterwards and said, "Professor, is there a way we can get our moms off their phones more?" And so, while you're talking, Laura, I'm like, yes. Oh, but who? Because I think that this, how did you refer to it? The health harming
products.
Health harming products is just as effective on the parents as it is on the kids. And so when I do parent talks, I really try to focus on, okay, they don't realize it. I'm telling them like stuff that their child should know, but I'm actually also kind of telling them like, what are the terms of service you've agreed to that you didn't read? Do you understand what a smishing account is or a smishing attack on your phone is? Do you know how to do a Google reverse image search to make sure that photo, that person that you're talking to online that you haven't met, to make sure that that really is who they say they are? Do you have Google Alerts set up for the name of everyone in your household? Can you spot the bot? Can you follow the money? Do you understand the role we play in the economic structure of all this? Do you understand Section 230? Do you understand the algorithms? Do you recognize AI psychosis, which I think is going to be the next big mental health crisis? Do you understand the real point of TikTok? TikTok is so regulated in China, and the kids there get very different videos than we get because China knows that it's such a powerful tool. And I think it was the Center for Ethical Technology, maybe, that said, asked if you ask a 14-year-old in China what they want to be when they grow up, they say astronaut. And if you ask a 14-year-old here, what do they say?
YouTuber.
Influencer.
Right? Or influencer.
Right. I mean, it doesn't take a genius to figure out a couple generations how this all plays out. And what role does dopamine play in all of this? And it's so comfortable to slide into that world. And I think that if we can help people be more objective about it, like I was mentioning earlier, the standard media literacy questions: who's the sender of the message? What's their motive? How's the message designed to get my attention? What information is left out, and who benefits or profits from this? And, there's like with the bots, with 52% of the accounts on social media platforms are bots, and most of them originate the former Soviet Union. Like, are we aware that so much of what they inject into this environment is just to stir things up? And do we understand the research that if we're on Facebook and we're angry, we stay online longer? So I guess I go to these events under the guise of helping the parents with their kids, but really I'm trying to help the parents because, like you said, we are the role models. And in many cases, I'm not sure that a lot of parents care. I think it's really easy just to put a screen in front of a kid. I mean, doesn't it break your heart when you're at a restaurant and you see a toddler with an iPad in front of them?
Yeah.
And I'm thinking, oh my gosh, in 15 years, I'm going to have to try to teach this kid.
Yeah.
And it's going to be really, really hard. Really hard.
Do we have an audience question? Do you want to ask that? And then I do have a follow-up too. I'm curious about.
Thank you guys for this great conversation. My question is for either of you. Julie, you said earlier, I'm not sure enough people actually care. And that's definitely backed up by public polling, awareness of the issue and where it's coming from. So my question is, institutions like academia and medical community have been sold out to the highest bidders, Meta, Roblox, TikTok. The Christian church in America is decaying and has failed to stop this crisis. Institutions, schools have totally failed us. And parents, when you talk to them, just put their hands up and they say, well, we had no guidance for this. We didn't know what to do while it was happening. So I know conservatives don't like regulation, but if the problem's not getting better. So my question is, whose job is it to fix this problem, if not the government?
Oh, that's a very good question. So I think that's to both of you. So who wants to start?
And I think that what Laura is suggesting is a great start.
Okay.
Typically, I'm not a fan of the government, but in this case, if they could pull it off, that would be amazing. Laura?
Again, it's absolutely multi-pronged because different parts of the population are going to respond differently. So in some parts, we'll need regulation. We need to get education into all the schools so that this is systematic. And we need to learn about brain health and mind health the same way in science class. We're teaching kids about their heart, their cardiovascular, their respiratory system. This needs to be simply integrated. And one of the books that I share is the Kids, Brains, and Screens book by a nonprofit called Screen Strong that you might want to look at for your students. It's mostly directed towards middle school, high school kids. But what's fantastic about this book is twofold. First, no commercial industry funding went into the creation of this curriculum. And that is so significant because right now, online industry funds a lot of so-called media literacy curriculum. Google has a curriculum that's in many schools. It's called Be Internet Awesome. Google does not have the best interest of children at the forefront. So when they're designing the curriculum, and this is consistent across curriculums that are put out there, they are using language that I say sends kids to the land of the foregone conclusion. Kids, when you use this,
Oh, yeah.
when you use Facebook, when you use Instagram. So in this book, Kids, Brains, and Screens, it's objective. It has 8 chapters. They have a book for little kids, actually, and for, this is the sort of elementary school version.
Superbrain.
The Adventures of the Superbrain. But what's perfect about this is that it starts with, this is how the brain develops. When we use these health-harming products, this is what happens to our neurological system. This is how it disrupts development. And then this is how we have a healthy brain. It does not talk about the foregone conclusion, the assumption that you have to use it. And that's something that we can all push back on.
Yeah.
I've never used social media except for 1 week in 2007. And I say I got an allergy to it. I thought these professionals that I had been working with making memes and likes, and I didn't know it. I didn't even understand it. So I deleted it after a week.
Your life is probably just as good without.
And I've managed to support getting some laws passed and educating communities and getting things done without using it. So I do like to make sure that in our menu, when we talk about this, when we are educating people, absolutely. And I think it sounds so phenomenal what you're educating about, Julie, that we also share. And it's an option that it's not required to use.
Yeah.
And out of the gate, we have a psychiatrist in Vermont that's working with our team. And he leads by saying, in no part of development for a child are any of these products, these social media products or smartphone products, are they a requirement for a child to reach any developmental milestone through adolescence? In fact, we know it hinders them.
Yeah. And, to answer the question also, there are a couple of priests that are rocking on Instagram and YouTube and with podcasts. So there are some faith leaders that I think are using it to spread a good message. I quit Facebook December 31st, 2018 and have never looked back. It'll ruin our republic, hands down. One of the things that I think when the person who asked the question referenced the government, I'm going to put school districts under that umbrella, because a lot of pushback that I get is, well, I'm not going to take my kid out of AP US history and put him in some media literacy class, right? And my thing is, when I do a training, it's like, you don't need a media or digital literacy class. It's completely cross-curricular. If you're a science teacher, here's how you insert it. If you're a math teacher, here's how you do it. It is applicable and usable in every single subject. So it really is much easier and accessible than people think.
So that is an interesting point, by the way. It's really a skill, is what you're talking about. As
critical thinking.
Yeah, it's critical thinking as opposed to a specific course, which I think is important. So the question actually is exactly what I wanted to ask, or in the same vein. So I'm going to bring it back to that again, because I want to have a little bit more of a topic or discussion about that. And that is, government overreach is really one of the biggest things that Moms for Liberty fights against, is government overreach, and specifically in parental rights. And I mean, it is kind of telling parents what to do by saying, if you were to have a ban or restriction, just like any other restrictions. So why should it be okay for the government to be able to put these restrictions on? And should it be at the state level, the federal level? How do we make that okay in the world where we don't believe in big government?
I think you start out small. I think you start out, like Laura suggests, with screen-free schools, screen-free communities. And, the government makes a lot of laws that are actually helpful for us. And maybe that's the sales pitch that we have to get into. I think, like you said, it's an uphill battle, but that's where I think the education comes in is one of the weapons in that battle.
Absolutely. That's when we're doing interventions in communities, they need to understand why regulations are being put in place. And with this product, because I'm from a small town in Vermont, we have 750 people. We definitely get annoyed if somebody from the outside comes in and starts telling us what to do, because we're very rural. We know what we need. But this is a different category. Again, when we just go back to what we were looking at, these are health-harming products. These products have been put into the same category as big sugar, as the alcohol industry, as products that are not healthy for our children. And we've accepted that we need support to prevent that kind of product exposure to our kids. Commercial industry is doing everything they can to get this into the cribs of babies.
Mm-hmm. Oh, God.
And so we do need help as parents to protect our spaces. So I'd say this is just something that will give a lot of relief to parents if we were able to get this language out there. And I mentioned when we were speaking before this interview, Texas got this legislation fully through their House. And I looked, this was just this past session in 2025. I looked, I'm such a nerd, but I went on and said I wanted to look at the votes. I wanted to see who voted, how many voted. It was an overwhelming majority.
Wow.
In favor, bipartisan, in Texas. Texas is, I think, just a bit bigger than Australia, actually. So they ran out of time. It got through the House and then it stopped. They're going to be back in session again in 2027. And it would be wonderful to see states putting that messaging out there. Because candidly, even if it doesn't get passed, if more people know that the House in Texas passed an age minimum, it was an age 18 minimum to access social media law. Very clean, simple bill. 1 page long. Anybody can read it. It just is common sense.
Wow, a bill that's 1 page long. That alone is shocking.
That's the shocking part.
I think one thing I'm going to answer my own question a little bit too is I've heard it stated that government, really one of the main purposes of government is to protect its citizens from outside attackers or from attackers. And so I think that there is an argument to be made that when you have these big corporations, unfortunately, trying to come after your children, its citizens, then there's a time where it can become appropriate. So I'm not saying that everyone's going to agree with that, because government overreach is definitely a problem, and I can always see the other perspective of when does it get used against you, and I hear that concern, but I think this is one of those examples where I think most people can get behind the idea that it's just too harmful. Frankly.
And another part of the mental health that we haven't covered yet that I really think is important is with the advent of AI generations or generative AI, we're in a space now where we can see a video and see a photo and not really know if it's real.
Yeah.
And how do we function as a society? Like, what does that do to our mental health and our ability to interpret the world if we don't know what's real and what's not? And so I think it all plays into that, because so much of the platforms contain that false information.
So are you going against AI, or are you doing anything to fight against AI as well?
Yes. It hasn't been introduced yet, but if it were up to me and I could tweak the bill, I'm not the lawmaker, I'm an advocate that supports our legislators, I would make that same bill just include at least the AI chatbots, which have been so damaging to children. So I would say no social media until at least age 18, just because it's hard to legislate a little further up to 21. Cigarettes used to be 18, then they moved up to 21. But at least we've captured the legal definition of childhood of, again, looking at our most vulnerable population. And so absolutely. And there was just a piece on 60 Minutes last night interviewing a family who had lost a child specifically because of an AI chatbot. So there equally as dangerous for our children, certainly. And I think just to follow on what you were saying in terms of why are we doing this and the concerns about government, it's really, this is not a bipartisan issue or even a differing issue between us. The real true dichotomy here is what is in the best interest of our children? What do our children need to grow and thrive? And then the commercial interests of these companies that are making health-harming products that make our kids get sick, and their priority is profits. And historically, across all industries, again, this is not new. These companies, these social media, online, so-called AI companies, they're all doing the same thing tobacco did, the diesel industry did, the car industry. They try to deny the science. They try
or create their own science.
And fund their own science, fund their own education curriculum. Mm-hmm. And so really the biggest thing we need to do is make sure the population has those critical thinking skills exactly to ask, where did this information come from? I am appalled that our school system has accepted these Google Be Internet Awesome curriculum into classrooms. Where was the discernment? I'm appalled that didn't happen. The first question when I testified to the Senate or the House about a year ago in Vermont, and they said, was this peer-reviewed literature that you're citing? And I said, oh, yes, it's peer-reviewed literature. And the researchers who created this research in this literature also were not funded by commercial industry interest that could create real or perceived bias in the recommendations they give. So there's that extra layer of filtering when we look at information that we need to...
Yeah, who benefits or profits from this? Because the very first thing I ask the students is that, do you realize that if you're using an app or a website for free, you're not the customer. You are the product being sold. And I think at the very basic level, very few people realize that.
So I want to ask a question that touches on what you guys are talking about, the experts here. Or sorry, you haven't officially said this, but what I'm hearing is... some people might consider these technology companies the experts because they're the ones that are doing technology, right? They're putting it out there, they've developed it, et cetera. So many people would think that the person that's best to educate would be the expert on it. This is another argument that we hear a lot of times frankly, in the health freedom area where, well, it's okay for pharmaceutical companies to be doing the research because after all, they're the experts in pharmaceuticals. So, and I fully understand the illogicalness of it, but how can you respond to someone who might think that, the technology companies are the experts, and so why shouldn't we listen to them?
One of the things I encourage science teachers to do when they're implementing media literacy skills is to look up research that's been in the news lately, find out the name of the study, and then find out who paid for it, and study how the questions were written so that they have kind of the BS detector that's installed, understanding that in most cases it all comes down to the money. And I think that it helps them recognize the role that big money plays in all of this, especially when it comes to research. And Mark Zuckerberg lied to Congress. I don't trust him at all.
That's very true. Yeah.
Well, another addition to that is to remind people that, as far as we know, the people who work for these companies do not give these products to their children.
Like the end of that the Social Dilemma documentary that was on Netflix. They all said they don't allow their kids to have phones or on social media platforms. I'm like, that's incredible. What else do you need to know?
Yeah. Okay. Well, that's an interesting one. All right. So I think we've had an incredible conversation tonight. Not quite as much fighting as some people might have expected.
Sorry.
But no, quite all right. I think that, I was more interested that we had a little more, the multifaceted tool of including the education. I think that is really important. I think that is a realistic way that we have to look at things. And I would encourage parents that if you can we were talking about this earlier, actually, if you can avoid giving kids phones, do it. Don't give them phones. Don't get them on devices, because then you have to be involved in monitoring. Mm-hmm. So you have experience with not being on devices. I want to give you 1 more minute each to just kind of any final statements or thoughts, your closing arguments that you'd like to say, and then where people can find you.
Well, I have experience raising my kids without using these products. And I will say not in the beginning. I was one of those parents in the beginning when my kids were young that I let my kids watch TV and on various things and way too much that I would not do now. I will say if I had known, then I wouldn't. So now I know, and we made a decision. I forget exactly what year it was, but this is just not working. So let's just stop. And it's been so much easier with 4 children to not have these products be part of their experience. They don't miss it. They don't feel left out. They now, as they're going into adolescence, see the advantages they have. Mm-hmm. And adults who meet them can tell. They can absolutely tell. And so I want people to...
They can talk.
They can make eye contact. Yeah. They can talk. They do deep reading. And my 12-year-old, when she was 12, she's now 14, was able, because she had never had that ability to focus taken away from her, pick up a library book. She picked up War and Peace and read it over a summer.
Wow.
I never read that book. I will tell you that. Maybe I shouldn't. I didn't, but she is now working her way through Charles Dickens. And I'm not, with 4 kids, you can't be a helicopter mom. That's not possible. You have to actually be hands off. Just go outside. That's kind of how, go outside and we'll feed you potatoes. That's pretty much how we're raising the kids. And, but so she has just been able to develop with that really strong sense of ability to focus. And now, again, she's seeing a difference. But I want people to know that with Screen Strong, it absolutely is possible. So Melanie Hemby has this book, The Screen Strong Solution. Dr. Victoria Dunkley has another book called Reset Your Child's Brain. There absolutely are tools for parents who have already given their children devices and exposure to social media. How do you safely do a reset? And when we say reset, it's not, I always used to think it meant when you reset your computer that they were just playing on terms. It actually means, how do we reset the reward pathway in the child's brain?
The dopamine.
So that they do not expect or need these high rewards. And so this Screen Strong has a spelled out map for supporting parents for how to do this. They have a whole community to come on and do it together and learn how to prepare, and then how to manage and support your child through that process. So I do want people to know that there is absolutely hope, and it is possible to do it. There are fantastic resources backed by child psychiatrists supporting what Screen Strong offers.
Fantastic. And screenstrong.org. Right?
Screenstrong.org is where people can start.
All right. Fantastic. Any final comments for you?
Yeah, I would, if anyone's watching and not really familiar with the whole media literacy or digital literacy world, I would encourage you to remember that the average American consumes between 11 and 12 hours a day of electronic mass media produced by corporations that do not have their best interest at heart. And it's important that we recognize this and view it critically. So if you remember anything that I said today, please remember these 5 questions. Who's the sender? What's their motive? How's the message designed to get my attention? What information is left out, and who benefits or profits from this? Because in our field, we don't say that one message is bad and one message is good. We just say, gosh, why don't we talk about this more than we do? And you can find me through Webster University or KMOX.com, or HeyJulieSmith.com is my website.
All right. Well, thank you both so much. This has been a wonderful conversation with real solutions offered, which is one of the things that I most appreciate. And thank you, viewers, for tuning in for this excellent debate-inspired conversation on whether or not we should ban social or restrict social media for minors. So what do you think? What are your thoughts on this? Should we be restricting social media for minors, or should we be educating them? Is it a combination? I think that it's a question that we're going to have to be addressing for quite a while. The purpose of the Rhetoric for the Republic is to help equip you with answer or responses so that when you're out in your everyday life, that you can answer confidently on these very tricky topics that come up. So thank you again for joining us, and we look forward to seeing you next time.